Alright, so I'm going to talk about cocaine, and I've got this handy dandy handout here for you. It's got pages to fill out during the presentation and a crossword at the back.
Thank you.
Okay, so what is cocaine? It is a stimulant drug. It's illegal. It is a substance that comes from a cocoa plant in South America, which I thought was really interesting. It comes in various forms: white powder, small crystal rocks, etc., and it can be really addictive depending on how you take it and how often you take it. So a brief history. It was first extracted from the cocoa plant in 1860. Scientists found out really quickly that it worked really well to numb the skin, so for a long time they used it as a local anesthetic. So they don't really use it like that anymore. We use synthetic anesthetics. And in 1880, Sigmund Freud, he wrote a bunch of papers praising, super excited about all the different uses of cocaine and how fantastic it was for treating things like depression and alcohol addiction and other drug addictions. And it was totally legal. It was in tons of drinks. It was in Coke, and it was no pun intended. And it was in different medicines. So they used it less and less when they found out how bad it was for you, all the negative aspects of it, and how addictive it could be. And it kind of blew up again in 1970. And at that point, it was really expensive. So it was mostly for the richer people. It was kind of a symbol of status. If you could afford cocaine, you were well off. And then they kind of came in with a less expensive form of it, which is crack. And so it was cheaper, and if you got crack, you were poor. If you got cocaine, you were woohoo! But in 1911, Canada put restrictions on it, made it illegal to import it and trade it and produce it and all that fun stuff, because, well, it's not very good for you. So it is a stimulant. So it causes most people to feel really energized. It'll cause you to be more alert, and at first you get a feeling of euphoria. Those feelings don't necessarily last, but it does stimulate your senses and everything. And some of its street names are crack, blow, coke, snow, rock, Charlie, C, other ones like that. So some ways of taking it are to snort it or inject it. And I didn't finish this. Oh, whatever. It's all good. So you can snort it or you can inject it with a needle. You can cut it and mix it with sometimes they'll mix it with cornstarch or something to sneakily get people high. And it can be smoked, and it can be mixed with alcohol. You can mix it in with your marijuana, just mix it all in there and smoke it in a joint. So I didn't put it on there, but for snorting, it hits you within 3 to 5 minutes, and it only lasts 20-30 minutes. With injecting, it hits you within seconds, and it lasts, I want to say 10-15 minutes. And then cutting or mixing it with similar substance, it lasts about 10 to 15 minutes as well. And smoking it also hits you immediately, but it doesn't last very long. It only lasts 5 to 10 minutes. Oh, and mixing it with other substances can be really, really bad for you, like alcohol and stuff. It'll make you more high, but it also increases your chances of sudden death. So some signs and symptoms really depends on how you're using it, how often, any mental health concerns that you might have, your state of mind when you take it. If you're happy, you'll probably have a better high, whereas if you're really angry and hating the world, you're probably not going to have such a fun time. But most people, when they get the initial high, are energized, they're talkative, they're not very hungry, they're not very tired. They'll just it's awesome. It's basically what it feels like at first. Some people, despite it being a stimulant, will feel calm, and they'll be more confident, and they'll be able to just sit calmly and focus, and they'll be really, really good with people and everything. And then there's a few people who just don't really get a good high at all ever. They go right to feeling anxious and agitated and irritable. So large amounts of cocaine can cause symptoms that are similar to psychosis, so hallucinations, which is like seeing, hearing, smelling things that aren't actually happening or around. Paranoia, so thinking that everybody's like after you and stuff like that, being really paranoid about everything, thinking that you're going to get caught. And delusions, which could be like, oh man, aliens are trying to take over the world, or like some things like somebody's trying to kill you. It's very similar to paranoia. They can cause panic attacks, and it can cause like erratic or strange and very violent behavior. It can also cause your heart to beat a whole lot faster, which raises your blood pressure and your body temperature. So some other signs and symptoms are dry mouth, dilated pupils, increased breathing, exaggerated reflexes, nausea and vomiting. There are some other ones like twitches and spasms, and like going from really hungry to like not hungry at all, having no interest in food, having really like violent mood swings. Okay. I'll watch a short little video. Oh, that's not the right one. About how it affects your brain.
Our brains are composed of networks of billions of tiny nerve cells. Signals race around these networks, crossing the gaps between the nerve cells using chemical messengers. One network is dedicated to making us feel good when we do something that is essential to survival, such as eat, drink, or have sex. Normally, when this network is activated, the nerve cells in it release the feel-good chemical messenger, dopamine. Dopamine travels across the gap from one nerve cell to receptors on its neighbor, triggering a chain reaction which makes you feel good. This dopamine then returns to the nerve cell that released it for further use. Cocaine hijacks the feel-good network in the brain. It causes huge increases in the amount of dopamine throughout the network, flooding the brain with feel-good chemicals. And it also stops the dopamine returning to the nerve cells that have released it, meaning more and more builds up.
Cocaine blocks something called the dopamine transporter, and what that does is it mops up dopamine that sits in the space between two cells. And if that reuptake is blocked, what you get is an awful lot of dopamine floating around this space.
The flood of dopamine sends the feel-good network in the brain into overdrive, producing a sense of euphoria and self-assurance, making the user more animated and talkative.
So yeah, that's how it works on your brain. So there are some serious dangers with using cocaine. So something that it does is it constricts your blood vessels, which affects how much oxygen goes to your heart and your brain and all that stuff. But it also causes your heart to beat faster, which can really, really put you at a risk for strokes, heart attacks, seizures, that kind of stuff. It raises your blood pressure, which adds to the whole stroke, seizure, heart attack kind of issue going on. So even if you only take a little bit, it can cause an overdose just because of the way that it affects your body and your brain. And with an overdose comes seizures, heart failure, your breathing could decrease significantly or could stop altogether. And there's no specific antidote or anything that they can give you if you go to the hospital with a cocaine overdose. You just kind of gotta ride it out. And cocaethylene is a chemical which increases sudden death, which is what your liver produces when you drink alcohol and take cocaine at the same time. Like if you mix them, your liver produces it and it goes into your body, and it just you could die just instantly just because you've got that chemical going through your body. So patterns of use, it's generally binging to keep the high feeling. So you're doing it it's like binge eating. You're doing it to make yourself feel good. or it's just continuous, like because the high doesn't last very long, you're doing it every, like just frequently over a couple of hours or sometimes even a couple of days. There are cases where somebody will like lock themselves in a hotel room and just like do cocaine continuously for days until they just like they overdose or they're done doing it. This fancy dancy table, which is also on your sheet about the risk factors and protective factors and the life area. So for individuals, a risk factor, some of the risk factors are being begins using at an early age, impulsiveness and sensation seeking, so risk taking, some poor social and coping skills, early childhood behavior problems, feeling alienated, some protective factors are well-developed social skills and problem solving and a sense of self-esteem. So it's really important as CUAWs to make sure that we help kids with this, like with their individual risk factors and protective factors, because these aren't just factors against cocaine, these are against any type of drug that they might start to abuse. For family, there's history and patterns of use and attitudes towards drugs, inconsistency in parenting, supervision, discipline, and nurturing, unclear family rules, expectations, and consequences. Family is conflict-ridden, experiencing disruption. And protective factors are good communication in general and specifically about substance use, supervision of children and activities, including the selection of friends. Rules are clear and consistently enforced. Child feels connected, valued, and supported. Parents have expectations of child success. So this is another really important thing, especially if a kid has already had a really inconsistent and crappy home life. Like in a group home, that's why there's so much structure, because it helps them to kind of develop these skills and to have that structure to keep them away from this kind of stuff. Next is peer. So association with peers who use alcohol or other drugs who are engaging in risk-taking behavior. And then protective factors are friends who do not use alcohol or other drugs and who do not support the behavior. One or more close friends form long-lasting friendships and rely on friends for emotional support. School is academic problems, lack of commitment to school, lack of sense of belonging in the school community. And protective is success and commitment in school, involvement in extracurricular activities, and school action messages on drug use. So for peer in school, it's kind of difficult for us to intervene sometimes, but it's really important to monitor these things and like try and help out a kid if they don't have many friends, and maybe educate them on this kind of stuff if you see them kind of leaning towards it. And for community, risk factors are alcohol and other drugs are easily accessible, community disorganization, and low neighborhood attachment. Laws, norms, and attitudes favor drug use. Protective factors are community-sponsored activities, strong social bonds, child feels connected, community action messages around drug use. Alright, so some indications of dependence. So these are really good to know if you are working with a kid or you have a friend or something like that and you kind of see them acting weird. It's good to look out for some of these. So something that really shows kind of dependence is if they've developed a tolerance to the high and if they can obtain that for longer. And experiencing symptoms of withdrawal when not taking cocaine. So if they stop taking cocaine for a couple of hours and suddenly they've got a bunch of withdrawal symptoms, which we'll talk about in a little bit, that is really an indication of dependence, because if you're only, they should never be doing it, but if they're only doing it once or twice every so often, they're not going to experience withdrawal symptoms right away. It's not going to be something that's going to happen to them. They might experience it if they did it more frequently, and then the more frequently that they do it, the more they'll experience the withdrawal symptoms. Another one is taking it whenever available. So if they are really isolated all of a sudden, and they don't really talk to anybody. They spend all of their time trying to get money. They might even steal from somebody who's taking cocaine, might steal from family, friends, convenience stores, anything that they can do to get money to pay for the drugs that they need. And like I mentioned before, cocaine can be pretty expensive. So it would be really important for them to be able to get a significant amount of money in a short period of time. So unable to successfully reduce the amount used. So say for instance you catch a kid or a friend using it and you kind of talk to them about it and they're like, yeah, I know it's bad for me, I'll stop doing it or I'll do less of it. And then they can't do that successfully, they can't hold up to that, that's a sign of dependence as well. Again, spending a lot of time and energy obtaining the drug. So if they're obtaining it, when it's available, if they're taking it every time it's available to them and then they don't leave any, like if they just use it all at once, that's another sign as well. So if you've got someone who cannot keep a job and they've got some of these other signs and symptoms, that can be a really big red flag, because if they're going from really, really high to really low and then experience a bunch of withdrawal symptoms, they're not going to be able to keep a job because they're going to be irritable and agitated and nobody's going to want to work with them. And if they're stealing from their job or they're just not going because they're going to get drugs, that's another sign. And continuous use despite knowledge of the effects. So if you talk to someone and they're like, I know it's really bad for me, like it's causing all these issues with my body, like I'm in this kind of pain and this is happening, and yet they keep doing it, that is another sign of dependence, because cocaine, once you're addicted, can be really hard to kick.
So the diagnosis of drug or alcohol addiction hinges on compulsive use of anything despite negative consequences. And whether the person is getting a bottle of liquor from the corner liquor store, getting heroin from the connection down the street, getting OxyContin from their physician, really makes no difference. Once the substance is causing problems in their life, it's time to get rid of the substance. I hear from patients all the time, well, this isn't a drug, I get this from my doctor, as if somehow that makes it okay. But, you know, there's a huge difference between grandma taking a Vicodin tablet, say, 3 times a day for her arthritic knees, and it's enhancing the quality of her life. You know, God bless grandma. But when a 25-year-old with no objective reason to be on any sort of painkiller is taking massive amounts of opiates, I think it's, you know, unconscionable of the physician to continue to prescribe those drugs. There is no inherent difference between a prescription opiate and a street opiate. They work the same way, they hit the same area of the brain. Another fallacy that I hear is also, well, pot is a naturally occurring substance, it's a plant, so therefore it's okay. Well, so is cocaine, a naturally occurring plant, a naturally occurring substance. So is the opium poppy. Alcohol is fermented sugar. So being a natural product or being a pharmaceutical product doesn't change how we make the diagnosis of addiction. And it's based on, are you having problems in your life because you're using these substances? And if you have problems in your life, then the drug is a problem, period.
So, yeah, that really relates to what I said about all the different, the signs of dependency. That's kind of what they use to diagnose. And the whole, it's a naturally occurring substance is really interesting to me, because there are lots of naturally occurring substances that are really, really bad for us. And I think it's a silly argument. But anyways. So for pregnancy and HIV, there's not a whole lot of clear information about how it affects a child once they've been born, because typically if a mother is using cocaine while she's pregnant, she's also using alcohol and other drugs, so it's kind of, there's always a mixture of different things in there, so it makes it kind of hard but if she's using it while she's pregnant, there's a high risk of miscarriage, there's a high risk of premature birth, there's a high risk of low birth weight. If a mother is breastfeeding and using cocaine, her child is exposed to all of the effects of cocaine. She's basically giving it right to them because it travels right into the breast milk and into her system. And cocaine is a really good one for transferring HIV, which sounds weird, but if you're injecting it, there's a good chance of you getting HIV if you're sharing needles. So there's a good chance of contracting it, and there's a good chance of transferring it without even necessarily knowing if you share your needles. So withdrawal symptoms, people often crash when they quit cocaine. If somebody's on cocaine constantly, then they're probably feeling high and euphoric all the time. So when they quit cocaine, they get mood swings, so they'll feel really high, and then their body kind of normalizes, and it'll go right back down, and they'll feel distressed, and they might experience depression or suicidal thoughts. So some other symptoms are exhaustion, but being restless and not being able to sleep at night. So you're super tired, but you just cannot settle to sleep. Hunger, but also having a total aversion to food of any type. You just don't want to have it in your system. It grosses you out. Depression and or suicidal thoughts, intense need for the drug, and there's a really strong possibility of relapse with cocaine because the high is really memorable. It sticks with you, so your body remembers it, and it wants the drug all the time. And so cocaine is a really, really difficult drug to kind of drop and be able to move on from for a lot of people. So these are some supports that you can use if there's Cocaine Anonymous groups all over. The link to that website has ones in this area. Peterborough doesn't have a Cocaine Anonymous group, but there's ones in Oshawa and all those places. I think there's the GTA has tons of them, but there's not one in Peterborough. There's an Ontario Drug and Alcohol hotline. So you go to the website and you can either call, so it gives you a number, or you can chat online. You can email, and I think those are the only ways that you can do it. I think that there's a forum as well that you can talk on. There's Kids Help Phone for youth who are doing it, or for youth whose parents might be doing it. And then there's the CAMH cocaine treatment, so they've got a treatment program themselves, and there's a couple different CAMH offices in Toronto. And those are my references. But I have a fun little quiz.
Yay.
Yay, quizzes. Okay, still broken. So, cocaine is a stimulant, true or false?
True.
Yay, you're right.
Yay.
Cocaine is a very safe drug to use.
False.
Indeed, it is false. What are some street names for cocaine?
Crack, blow, snow, coke.
So, blow, crack, rock, snow, coke, and so on. So yes, you were right. Some ways to use cocaine.
Inject it. That's what you're talking about, right?
Mm-hmm.
Injecting, snorting, smoking.
Yep. Mixing it with other substances as well. After feeling high, the user experiences no other symptoms. True or false?
False.
False is right. What are some signs and symptoms?
Talkative, energized. They could get anxious or agitated. They could feel confident and calm. Depends on the person.
Yep. Yes, yours were right. I just didn't wrote
Yeah.
different ones. It's all good.
Yep.
Quitting cocaine is very easy. True or false?
False.
False is right. Symptoms of withdrawal include
Crashing
Yep.
and agitation, jitters, things like that.
Yes. Exhaustion, restless sleep, all that fun stuff. The chemical produced when mixing alcohol and cocaine is called. It's okay if you don't remember because it's a weird word.
It was like a I don't know.
Coca
Coca.
ethylene.
Cocoa ethylene.
Ethylene, yeah. There we go.
Awesome.